Hello and welcome. This video will cover all of the information for this topic. Feel free to watch the full video, or if you prefer, you can scrub along the timeline at the bottom and jump straight to the section of your choice. A fitness organisation, like any other workplace, must operate within health and safety law. The Health and Safety at Work Act 1974 forms the basis of UK health and safety law and sets out the duties that employers and employees have to themselves and the public. The Health and Safety at Work Act 1974 is a central piece of legislation implemented by the Health and Safety Executive. It aims to prevent the risk of injury and is applicable to all businesses in the UK, whether for profit or not. The Health and Safety at Work Act is legally enforceable if organisations, management or staff fail to comply. The two main duties of an employer are to take care not to endanger themselves or others and to cooperate in meeting the health and safety at work legislation. All employers have a legal responsibility to ensure that they maintain the health, safety and welfare of the workplace, workforce and public. That risk assessments are completed and implement practical measures where appropriate. Employers must have appropriate health and safety policies, procedures and documentation and suitable liability insurance to cover any incidents. All employers must provide information, instruction, training and supervision to all staff, whether they are paid or not. All employees are entitled to work in environments where risks to their health and safety are properly controlled. The primary responsibility for this is down to the employers. An employee's legal responsibility are to take care of their own and others' health and safety at work, to cooperate with employers' safety policy and procedures and report any concerns immediately to an appropriate person. Employees must use all equipment and personal protective equipment appropriate for the task and in accordance to the training which they have received. Employees must also ensure not to misuse or interfere with anything provided for the use of health and safety, such as personal protective equipment or any equipment associated with the task or documentation relevant to health and safety. The term duty of care is the obligation to apply a reasonable level of care and avoid any neglect, malpractice or poor professionalism. Having a duty of care is relevant in the workplace towards your employer's policy, practices and procedures. It is also relevant towards yourself, colleagues, clients and the public, where your duty of care is greater when working with specialist populations. It is also appropriate to have a duty of care towards the facility and the environment along with the equipment. In terms of being a fitness professional, our largest duty of care lies in both ourselves and our clients. As fitness professionals, we have a duty of care to ourselves and our clients, both when they are and are not training with us. Personal duty of care involves holding appropriate qualifications suitable for the clients and activities which are being carried out, holding public liability insurance in case of any accidents or injuries, adhering to set organisational procedures and industry professional bodies' code of conduct, and by ensuring that you have an awareness of health and safety policies, including holding a valid first aid or CPR qualification, especially if working with certain high-risk population groups. In terms of your duty of care to clients, all clients should be appropriately health screened before exercise, using appropriate methods such as a park queue or verbal screening checks, and by ensuring informed consent before activity commences. Clients must be signposted where necessary to a qualified medical professional, and by ensuring that clients dress appropriately by wearing acceptable footwear and no jewellery, along with promoting safe exercise and activity. Supporting clients' exercise technique and the use of equipment by observing and correcting whenever necessary is all part of a professional standard and a duty of care you have towards your clients. The Management of Health and Safety at Work Regulations, 1999, is a key document outlining the key details to manage health and safety in the workplace. It identifies in more detail what is required from employers to manage the health and safety in the workplace, including ensuring employers keep the workplace and facilities safe. The Management of Health and Safety at Work Regulations ensures that visitors and members of the public are not put at risk, as management must address all areas of the risk and put in place procedures to manage these risks. This is achieved with associated documents underpinning safe working practices, including risk assessments, normal operating procedures, known as NOPs, and emergency action plans, known as EAPs. Dependent on the risk assessment outcomes within an organisation, will determine which other key regulatory acts must be adhered to. These could include such things as first aid legislation, which covers the requirements for first aid provision, such as the number of first aiders working, who the first aiders are, and the first aid kit requirements within the facility. RIDDOR, which is the reporting of injuries, diseases, and dangerous occurrence regulations. This legislation requires employers to report injuries and some diseases and allows enforcing authorities to investigate serious accidents if they occur. Manual handling legislation may need to be adhered to if hazardous lifting cannot be eliminated and mechanical means to support the lift cannot be used. PPE, which is personal protective equipment. This will give guidance relating to the protection for specific tasks, such as dealing with chemicals, for instance. COSH, which is the control of substances hazardous to health. This regulates hazardous substances used in a working environment which could cause any harm or ill health. There's also legislation which covers employers' liability. This ensures employers have compulsory insurance specific to their liabilities. Noise at work regulations, which requires employers to take precautions to protect hearing from damage. Electricity at work regulations, which ensures guidance on all electrical equipment in a working environment is both safe and well maintained. And working at height regulations, which ensures that training and suitable safety equipment to be used where necessary. There are many other key health and safety documents, all of which should be identified whether or not they need to be used within an organisation through a risk assessment. The managers or directors of your organisation will take ultimate responsibility for both the health and safety of the organisation, but some members of staff will also have specific health and safety roles appointed to them. Failing to follow legislation could lead to serious consequences for both yourself and your employer. The considerations of the court will include what the current standard working practices are within the industry and the chain of responsibility to highlight areas of negligence. An example of negligence may involve not screening a participant prior to exercise who has known exercise contraindications, for example diabetes or coronary heart disease. Depending on the findings of the court, you may be fined or disqualified from a professional membership organisation, or more seriously, you or your employer could end up in prison. By knowing and following current health and safety legislation, employers and employees can protect themselves from such action. You have now completed all of the content from this topic. If you have any questions from what was covered, please contact your tutor. Or if you'd wish to test your knowledge, why not try some of the mock questions? If you're happy with your progress in learning, feel free to move on to the next topic.